So I really do encourage people to get out of bed and walk from day one. Now, I'm not talking like miles or even 20 minutes, vaginal birth or C-section, but especially a C-section. And that probably sounds counterintuitive to a lot of people, but it is so important that you are out of bed with help. Especially if you had a C-section, have help with someone helping you out of bed, but walking around your room a little bit, walking up and down the halls. And you could start with just a couple of minutes at a time to really help promote healing, but help decrease risk of complications to surgery.
A review of the week this week is E. Reese 307. She says, game changer for a first birth. This podcast was my best resource during pregnancy. I just had my first baby, and before the birth, I listened to every episode of this podcast, which always blows my mind because there's like a ton of them now. So good job. But she said, my birth preferences went out the door when my babe was diagnosed with fetal growth restriction, and I was scheduled to be induced early. This podcast gave me the strength and knowledge to stay positive and continue forward to have the most amazing, natural-ish hospital birth. Now I have a beautiful baby girl who is healthy as can be at 1 week old. Thank you. Congratulations to your beautiful baby girl. And yes, that's the whole point, you guys. If things go sideways, it's okay. I think having the information and being able to walk through that with confidence and being a part of that decision-making is where it's all at. So today I have with me Dr. Arielle Martone, who is a doctor of physical therapy who specializes in pelvic health in pregnancy and postpartum. And we know this is a topic you guys have asked for, so I'm super excited to have her with me here today. She is a certified yoga teacher, certified pre- and postnatal coach, pregnancy and postpartum corrective exercise specialist, and postpartum nutrition professional who herself is a mom of two. She founded the Find Your Way Mama LLC perinatal physical therapy and wellness to empower moms and moms-to-be through whole person care so that they can reclaim their bodies, their confidence, and their well-being to get back to feeling like themselves again. So with that, welcome to the show. Welcome to the podcast. We're excited to have you here with us today. And I'm excited because I feel like you're going to be a wealth of knowledge for all the questions that I know moms have for postpartum pelvic care.
Yeah, well, thank you so much for having me, Stephanie. I'm really happy to be here. And I certainly hope that I can provide a lot of information and, to your point and to your reviewer, like the information that they need to help them along their journey, but also as things don't always go according to plan. And when you're met with those roadblocks, it's really important to know, like, is this something I can do something about? And if so, what are the things I can actually correct and change and move forward with?
Yeah. Can you kind of talk about what you do, how you specialize in pelvic health and all of that? I know this has been, gratefully and luckily, this is like a new topic of conversation. We're hearing it more and more. And I'm grateful that you're here to talk with people who are still pregnant. But tell me a little about what you do and what that looks like.
Yeah, so I am a physical therapist by profession. I'm now specializing in pelvic floor physical therapy, primarily in pregnancy and postpartum. But, as we all know, that postpartum phase can really extend out. So any type of issue that may have arisen during the postpartum phase that you are still dealing with, maybe a year, 2 years, 3 years, so on, then those are the women that I am primarily working with one-on-one I do in-work in a clinic, and then I also provide home visits throughout like the North Shore. I'm just north of Boston, so throughout the North Shore, especially for the early postpartum visits. I think the home visits are vital, but that's the bulk of the work that I do in person. I also have a postpartum plan, which really incorporates a lot of the other aspects that you mentioned into it, the postpartum nutrition, as well as a lot of yoga practice, but a lot of the yoga philosophy, mindfulness, presence, and bringing that into your overall postpartum plan, because it relates 100% back to your pelvic floor, but also to how you're feeling as a whole person.
Yeah. And I definitely want to come back to this, like, when should we start looking into this? I want to touch on that in a minute, but can you walk me through postpartum recovery a little bit? So what does this look like for moms? You kind of talk about phases. So can we talk about what are those phases?
Yeah, so the phases of postpartum recovery are the same phases for any physical healing. And our bodies do actually need to physically heal postpartum. And I think that's a common misconception, is that we don't have to do anything about it, that the healing just kind of happens. And I like to say, like, it does, but we need some guidance in order to really optimize it. And the best comparison that I can make is kind of if you sprain your ankle, it's going to heal, right? You know that eventually you're going to be walking on it again. But what is that walking looking like? Are you hobbling around? Are you walking how you were before? Are you running and doing the things that you wanted to do before the ankle sprain? Chances are, if you're just, walking it out, getting over it, moving on with it, that you're going to have some limitations that affect the ankle, and bringing it right back to pelvic floor, probably affecting your pelvic floor as well, because we know how vital the feet are to that. But if we actually kind of encourage proper healing to happen and go through the phases, and I'll talk about them in just a second, then we're going to not only have that ankle heal, but be able to get back to doing all of the things that we want to do on it without those nagging aches and pains that kind of keep creeping up on us. We absolutely need to and deserve to heal our bodies after having a baby. And we can look at the phases of healing, which are inflammation, proliferation, and remodeling. And when we were talking about inflammation, it's kind of like a dirty word nowadays. Like, nobody wants any inflammation, but it is important in the early stages of tissue healing to have some level of inflammation. It's what really brings more blood flow to the area. It's what brings in the white blood cells to kind of think about like removing any debris from any damaged tissue and being able to bring in more of the good stuff that we need. So we need some level of inflammation early on, but that should really be, immediately after to upwards of like 6 days, like a week tops. After that, we need to move into proliferation. So we need that inflammation to be down after that first week. And we need to allow our body to start in the proliferation phases where we're really like rebuilding the tissue. If you're talking about like an incision, that's where the incision starts to really fill in. And so if we're having any type of vaginal tearing, episiotomy, if you have had a C-section, that's when you're noticing that incision itself, you can physically start to see the healing occur. But also to our muscles, they're also rebuilding during that phase. And that is about 4 weeks in length, generally speaking. But that is not the end all of everything. After that, we really need our body to move into the remodeling phase. And that goes from about 4 weeks to 2+ years. And during the remodeling phase, we really need to balance out like the stress and strain principles to allow our muscles and our tissues to heal and rebuild appropriately. And that's really important during that phase that we're putting them under stress to some extent. We grow and we change and we adapt in all areas of our life, mental and physical, under a little bit of pressure, under a little bit of discomfort, not pain, but some discomfort, some, where you're going to have to work through something. But we want to make sure that we are just getting right up to that level and not pushing through it where you're risking re-injury, or that you're not doing enough and you're not really rebuilding as you need to.
So can you talk about the rebuilding a little bit then? Like, what does that mean to rebuild?
Yeah. So when we're rebuilding, we'll talk about first like an incision, right? So if you're talking about a cesarean, and we talked about the proliferation, it's when it kind of fills in, and we're starting to see that incision line is more closed. You're getting into that more scar look where it's not as red anymore. As we're getting into that scar, that's when we need to rebuild that tissue, because scar tissue is different than our normal skin tissue. And that's okay. That's fine. That's part of the healing process. But we need to, again, work on the stress and strain principles and work on the remodeling phase in order to get it to function as best like our normal skin integumentary system would prior to having the scar there. And that's where scar massage really comes into play, because we're loading the tissue when we're doing that. We're loading it and we're stressing it so that the fibers reorient themselves so that they can function better. Because during that proliferation phase, things are just kind of being laid down a little bit haphazardly to fill everything in. And then with the massage and the rebuilding, we were kind of able to can think of like a fishing net kind of lumped in together. It's like a knotted mess. And then as you're working on the massage, you're kind of realigning everything so that you're getting that nice like woven network. So that's really the remodeling and rebuilding. And I kind of use them interchangeably. And then when we're talking about the muscle function, it's a very similar concept of our muscles change a lot during pregnancy and then during the delivery itself. So they're changing during pregnancy because the load that they're under is a lot greater at just carrying the weight of your baby. As your pelvis kind of shifts and prepares for birth, it changes the length of the muscles. And then during the delivery, so even if you've had a C-section, you're going to undergo those muscle changes that happen throughout the pregnancy, right? So it's not like your muscles aren't affected. And then, everything in your body is affected. You can tell like how you're walking is usually different, how you're standing, all of that. So your muscles throughout your body are kind of repositioned a little bit. And then when we are birthing our baby, the muscles undergo more of a stretch, more of a strain. They lengthen almost 300% their original length at the pelvic floor. So the remodeling is really working on realigning that length. It takes some time. That doesn't necessarily happen in that 4-week time period. And so it's building back the strength that the muscles had prior to really getting pregnant in the first place.
And that's what you work with women one-on-one to be able to do?
Yes. Yeah. Okay. As well as any issue. So it's not all strengthening. We have to work on relaxation as well, building back their strength so that they're able to do what they were doing before, but also working on preventing any postpartum issues from developing. And if anything is developing, any type of pelvic floor dysfunction, if that is arising, catching it earlier is always better because the sooner we catch something, the sooner we can start to address it. Generally, the quicker the recovery is going to be. Take urinary leakage. Like it's something that's so normalized, like peeing your pants when you sneeze or laugh after you have a baby is just like joked about, like, oh, that's going to happen. But if you continue to just normalize it, and then you're noticing, okay, now I'm 3 years out and I'm like over it at this point.
Yeah.
It's still absolutely something you can work on, but it's just going to take a little bit more time.
Got it. So when you're talking about pelvic floor dysfunction, are there other things other than like urinary leakage that tell women it's time to get some help?
Yes. Yeah, there's so many things. So it's several issues with bowel and bladder. So that can be incontinence. So if you're leaking urine, but also, and this can happen more earlier on if you're having a problem with retaining your urine. So you're not able to urinate when you need to, or you feel like you're needing to strain or push your urine out. If you're feeling a lot of like UTI type symptoms, that like itching, discomfort, that feeling like you need to go to the bathroom constantly, but then you're not really getting a lot of volume out, and you don't have an actual UTI, that is a sign of dysfunction as well as like having to go to the bathroom multiple times. Let me rephrase that. Everyone has to go multiple times a day, right? That's not what I mean. But if you feel like you're constantly running to the bathroom, you have that small bladder syndrome, that's not a thing. And that's a sign that you need pelvic floor physical therapy. So that's some of the bladder issues that can signify some type of dysfunction going on. And then there's a lot of bowel issues that happen. And a lot of bowel issues happen postpartum that aren't really talked about at all. So we know about the leaking urine when we jump and laugh and sneeze. And that's been so normalized that, that we just expect it to happen at this point. Whereas bowel issues, on the other hand, are something that are not really talked about at all. And they are almost just as common. Like their frequency is not as likely to happen as urinary leakage, but right up there with it. And that is constipation being one of them. People don't think that that's an issue. That is something that if we are talking about bowels, that's something that we will talk about, especially in pregnancy, right? But also having some bowel incontinence as well. And that doesn't mean that you're physically having a bowel movement without meaning to. It can mean that. That's more of like the extreme version that can happen. But it is even just like an inability to wipe clean, where you're feeling like you're constantly wiping and you're just not able to get clean, or you get clean and then you go back to the bathroom later and you're noticing that, oh, wait, there's still a little bit of something there, or you're noticing some like skid marks in your underwear afterwards. So those are all signs of like bowel incontinence, or all kind of lumped together as bowel incontinence that can happen after having a baby. And I think that it is something that I see a lot with the women that I work with, and it's definitely not talked about much. So it's the bowel and bladder issues. And then when we're talking about dysfunction, we can have a lot of pain. And that can be pain really anywhere in the pelvis, the hips, or the low back, and they're all really interconnected. So if you're having a new pain for you, there's not like a reason that you can pinpoint, especially if you're, pregnant or postpartum. In any of those areas, that can be a sign that we need to look at your pelvic floor and just see what changes that we need to make. And that's also including the pain with intercourse as well.
Yeah, so that's a lot.
It's a lot.
Feel like that describes most women postpartum.
Mm-hmm. You're checking at least one of the boxes.
Yeah, exactly. So thinking of that, when should women start looking into pelvic floor health? Is this something that they just see you postpartum? Is this something that people should be looking for help prior to having their baby? Like, when do they come see you?
Ideally, I love working with people throughout their pregnancy. There's a lot that we can do throughout your entire pregnancy. And where I'm at, we have like a pregnancy program that will make sure it's not like a specific length of time, because everybody is different and their needs are going to be different. But there are specific boxes that we make sure that we are addressing. And, that goes into, for pregnancy, like beyond the pelvic floor, having like wrist issues, upper back issues, like that carpal tunnel sensation that people get in pregnancy quite often. But with regards to the pelvic floor, that's something that we address throughout pregnancy as well, making sure that the pelvic floor is functioning properly throughout the pregnancy, that it's adapting to that increased load of the baby well, that it's doing a good job with that we're strengthening when we need to. And then towards the end, that we're also allowing those muscles to practice lengthening and relaxing, because that's what they're going to need to do during birth. We can really get a good assessment of what's going on with the pelvis. If there's like any asymmetries, which there's usually an asymmetry, right? We're not symmetrical beings, to say the least. So there's usually some type of asymmetry. So it's working with that and informing them, okay, like I'm noticing your pelvis is slightly shifted in this position. So when you're in birth, like maybe because of that, like giving them specific positions to try based off their pelvic presentation. And there are always guidelines, right? Because once you're in birth, like you need to listen to your body. That's going to guide you the best, but at least you have a game plan of like what to try and see if that's working out. But if we are, talking back to like preparing for postpartum, if we're really preparing the muscles ahead of time, their recovery generally is going to be a little bit better. Just like with anything else, if you're, if we're going to talk about rehabbing like a knee or a hip, if you do your prehab beforehand, your recovery afterwards is always going to be better than if you're not. No time is too soon to get in to be seen, but ideally, if you can get in by your third trimester to really start doing some of the prep work. And if you're not able to get in, to see a physical therapist, at least start thinking about planning for your postpartum during that third trimester. I feel like that's a big piece that we kind of neglect as moms, is our own healing and our own recovery.
Yeah, definitely. How about, what are some things that you have every mom do, or the women that are listening right now, what are some things that they can do while they're pregnant to help prepare that area for postpartum?
Yeah, so breathing is always kind of a go-to. Like it's very much connected to the pelvic floor. It's where we start with our postpartum recovery, is getting back to our breath, reconnecting to that. And then also goes into like my yoga background as well, of being like a fan of breath work in general. In pregnancy, as our belly and baby expand and grow, our rib cage tends to splay out a little bit wider. Our diaphragm isn't in that really optimal dome-shaped position anymore because of the rib cage. It kind of flattens out a little bit more. So we're not breathing as effectively, and that ultimately is going to be affecting the pelvic floor. So really working on a full 360 expansion of the lungs, breathing out laterally, but then also breathing into our back body. So kind of directing the breath there can be really helpful. Visualizing and directing the breath down to the pelvic floor on the inhale. Yes, I know the breath doesn't hit the pelvic floor directly, but visualization is really helpful, and it can, as our diaphragm lengthens, our pelvic floor should work the same. They should be coordinated. So kind of practicing that, allowing it to lengthen on the inhale, and then just a passive, like let everything relax up on the exhale.
Yeah. Breathing. I think breathing is huge. And it's funny because I did pelvic floor therapy. I did it several years after having my last baby.
Mm-hmm.
And I hold tension. So like I'm just sitting tensed at all times. But when she did the breath work, I was like, how do I not know this? Like even I've done yoga and stuff. Nobody had said that, at least any of the yoga instructors that I had been with, that like when you breathe in, you should feel like that area lengthening, pushing out. And when you exhale, it should come back in. And just that alone, I'm like, oh my gosh, every pregnant mom needs to know that. In fact,
yes.
You know what, like for labor and for everything, like it's so important. But even like bringing your mind, your attention to it is like, you don't know it exists necessarily. I didn't know it existed until somebody told me that it did.
Yeah. And on one hand, we don't want to be paying attention to our pelvic floor all the time, right? Like we don't want to be aware of it. We want it to just function the way it's supposed to. But yeah, it is really important to like every so often be mindful of connecting our breath to our body and really feeling the impact that it has. And, as we're doing the deep breathing, and not just that big belly breath where you're like doming out in your abdomen, but really thinking about drawing the breath down, getting your ribs to expand, then expanding both front and back evenly, as opposed to just that belly. As you're breathing deeply like that, you're stimulating your vagus nerve, which also then helps to relax your pelvic floor a little bit more and relax your entire body a little bit more. So there's a lot of benefits to that as well.
Yeah. Or even just understanding that area, because for example, myself, where I sit tense and I'm like, oh, that makes sense when I spent 4.5 hours of pushing, why it was so hard for me, because I was like, I don't want to let go. I don't know how to let go, but even like practicing that breath work and you're like, oh, if that can release, like we see that a lot when it comes to pushing, especially moms with epidurals, right? Like explaining to them, or even first time moms, like explaining to them, it should feel like you are pushing a poop out, like you have to release everything and open and just let it go. But if you have practice with that beforehand, I feel like just that connection can be so useful.
Yeah, especially with the epidural, because I feel like the hard part with the epidural is like you need really good body awareness ahead of time to feel comfortable moving around with an epidural, because I had an epidural for both of mine, but I felt very comfortable moving around. And you can. I feel like that's a misconception too, is that you have an epidural and you have to lay flat. That's it. Maybe you'll be on your side with a peanut ball if you're lucky. But like, no, you can move around. You can be kneeling. As long as you're in the bed, they're going to basically let you do whatever you need to do at that point. The more that you can practice, connect to that area, and just get a good sense of what your body is doing, where you're holding tension. Because a lot of times, once you bring a little bit of awareness to it, you're going to be able to catch yourself throughout the day. Like if you're, sitting at your computer for too long, oh, great. Like my tailbone is tucked under again. I'm really like clenching my glutes, and then you can just let them relax. Or if you're standing in line or doing the dishes, like those are two big times where like we're often tucking our butt under and kind of clenching our glutes a little bit. And all of that really tightens up the back of the pelvic floor in particular, but really tightens up the whole pelvic floor.
Yeah. Okay. So like moving into the postpartum conversation here, what does that look like for moms? Like I feel like we're getting a lot of different information about what moms should and shouldn't be doing postpartum. And then you have the moms who are like, I just want to be able to do whatever I want to do, like whatever feels good. If I want to get up, I want to get up. If I want to rest, I want to rest. If I want to go for a walk, I want to go for a walk. So how do we safely, knowing what you know today, how can you like share this with moms to like what looks good for any mom to be able to do moving into postpartum?
Yeah. So it is about balance, but movement is really important for our recovery process. It's going to improve blood flow, which helps with our circulation. It helps move us out of that inflammation stage so that our inflammation, we're not just stuck inflamed in that area, but improving the circulation just allows everything to kind of move out, get better blood flow to the area. So I really do encourage people to get out of bed and walk from day one. Now, I'm not talking like miles or even 20 minutes, vaginal birth or C-section, but especially a C-section. And that probably sounds counterintuitive to a lot of people, but it is so important that you are out of bed with help especially if you had a C-section, have help with someone helping you out of bed, but walking around your room a little bit, walking up and down the halls. And you could start with just a couple of minutes at a time to really help promote healing, but help decrease risk of complications to surgery. So we know we are getting full cardiac patients up out of bed right after their surgeries. Why are we not getting women who had a C-section up and out of bed right away? It blows my mind. So we should be walking from day one, a few minutes at a time. And, in my postpartum plan that I have a gradual walking progression that really slowly guides you up to the first 6 weeks. And at that point, about 30 minutes is what you should be doing. Right? Well, we'll use quotes for that because it is all relative. And it is important to listen to your body, but you don't know unless you start to try it. So if you're getting out of bed and you're doing a little bit of walking and you're noticing, oh my gosh, I'm feeling a little bit dizzy, or I feel like my heart is racing, then you know that activity is too much for you right now. Which is why it's really important, again, especially after C-section, to have somebody with you for those first few times, is to really see how our body is handling the recovery. And if you feel great, amazing, you can keep going a little bit. But we also want to take into consideration the pelvic floor changes. And so we're noticing, what is our bleeding doing and what is that looking like? And if we're really increasing our bleeding, then that's a sign that we need to slow it down and back up, but also just allowing for rest. So we'll do a little bit of walking, but then come back and lie down flat, allow our body to rest, take gravity off of the pelvic floor muscles for a little bit as it's recovering. So it is a balance. It's always, best to have it be tailored to you and have it be a little bit more specific to how you're doing. But even if you were an athlete ahead of time, this is likely, especially we'll say if this is this is the first time that you are now an athlete who is postpartum. So your pelvic floor is not used to the task in its new postpartum state. So it's not like if you've worked out all through pregnancy, you're feeling really great, you're generally a really strong person, to just go ahead and get back into what you were doing prior to the 6 weeks, even if you're feeling really good. We do need to kind of gradually build back up to that, keeping the phases of recovery in mind as we're doing that. So starting with gentle movement where we're just encouraging blood flow to the area, and then gradually working on some exercises to support the pelvic floor without weight, and then kind of gradually increasing the weight from there, as opposed to just jumping right back into what you were doing. With higher level activity, so really higher level powerlifting or high velocity training, running, things like that, we know that ideally waiting to 12 weeks is best practice. Now, with that said, there's always going to be some wiggle room, and this is where the individual really comes into play. And this is where we'll take running, for instance. Some people, running is their me time, it's their sanity, it's the mental clarity that they need. They're getting all of those benefits, for their mental health, the endorphin boost, all of that from running. It's a tough call. And so you really, if that's you 100% want to be working with a pelvic floor physical therapist or pelvic floor occupational therapist to get you back to that, possibly a little bit sooner, or seeing if we can kind of modify certain things, maybe changing how you're running or the surfaces that you're running on and what can work for you if you have to get back to it sooner. If going for a walk isn't cutting it for that endorphin boost that you need, because it is a balance. We're faced with a lot postpartum between managing the mental and emotional load as well as the physical changes.
Yeah. As you're talking about this, I'm curious because you talked about the different phases and how long each of those can take and kind of what happens during that. So for moms who are working through those stages, at which point, I know it's yes, if everybody could get in at any point, that's great. But is there a point where you're if you're noticing this in this stage, definitely come see somebody for help?
Yeah. So the signs of dysfunction that we mentioned before, if you're having any of that, that is a sign no matter where you are in your postpartum recovery timeline. Maybe you're just noticing it at 6 weeks. Maybe you're noticing it at 3 months because you were more sedentary for the first 3 months. And now that you're moving more, you're noticing changes. So whenever you're noticing any signs that you're going to try to normalize in your new mom brain, like, oh, this is just mom life now. So whenever you're selling that to yourself, like that's a sign to get checked out. But otherwise, like my recommendation is in a perfect world, we would be met with a physical therapist or occupational therapist before we left the hospital. But that's not where we are for most of us. But I do for the women that I work with in pregnancy, I do schedule early postpartum visits with them. If everything's going well, I try to see them at least once before their 6-week clearance, just to see how everything's going. There's a lot that we can address other than like internally looking at the pelvic floor. We can look at like posture, how they're moving around their house, energy-wise, where they're at, like lots of different things, how their blood pressure is adjusting, because high blood pressure for preeclampsia is not just a pregnancy issue. It can happen postpartum as well. So just monitoring for all of that as you're doing all the tests that you have to do as a new mom that's like just loaded onto your plate. And then for a C-section, I really recommend at least 2 visits. One, the sooner, ideally the sooner that you come home, the better. That way we can really make sure that you're maintaining your precautions, moving around your house well, and then having another one before your 6-week appointment. And then kind of going from there based on how you're doing. If we're noticing anything that needs to be addressed, we would increase frequency. If things are looking great, we could just do more periodic kind of check-ins, allow for that resting, like set them up with a good like a walking plan and making sure that their nutrition is kind of on point and all of that in those early first weeks. And then say, okay, like things look good, keep up with all of this. And then we'll see you in 8 to 10 weeks and kind of go from there to really start building up the strength.
Yeah. So how, like when women come to see you, how long should they be meeting? Should they expect to meet with a pelvic floor therapist? And I know that's going to vary, but like, what do your averages look like?
My averages postpartum are, again, on average, I would say right around 10 visits, between 8 and 10 on average. Some are longer. The ones that are longer are usually people who've had pelvic floor things in their history for a while, whether it was, a fall on their tailbone from years ago that kind of left some low-lying issues that, again, just never really were addressed until now that they've had a baby and things are a lot more noticeable than before. So I would say if everything looks great, you've had no pelvic floor issues beforehand, average is probably like 8 to 10 visits, but it really is, very much individualized. So totally. it's hard to say.
Totally. Yeah. It was just making me think, I'm like, I bet moms that are listening are going to be curious. Like if I go, how many times am I going to have to be going? Yeah. So just like having that in the back of their mind. I love how you talked about too, that there are kind of signs to tell when you're overdoing it, like through the stages. So even when you like get up and you're moving and all of that, if you start bleeding more or you start having any more of these issues or these issues increase in severity, that those are all kind of signs to let's back up. And because I know some women are super active postpartum, or like they can't lay in the bed and they got to do the thing. But then we do hear, but we're bleeding a little more heavily. And now we're wondering if there's other issues, or we've got a drop in breastfeeding in our breast milk. And so it's so fun postpartum. Yeah.
I feel like the breastfeeding one is kind of that hidden, not really talked about sign that they're like, oh, I'm just not a producer. And you're like, well, maybe, like, sure, some people are going to naturally produce more than others, but are you meeting your baby's demands? And if not, then that's probably not that you're like just a low producer, but let's see like what's going on and are there things that we can do a little bit differently?
Yeah, totally. Is there anything that you feel like hinders recovery?
Yes.
Like, what are those like major like red flags? Like, do not do this, postpartum.
Well, so I wouldn't say it's a do not do this list necessarily, because we talked about like running before 12 weeks, ideally no. Really heavy powerlifting before 12 weeks, ideally no. But again, if that's your mental sanity, you need that for your mental emotional state, then we kind of have to weigh the pros and cons of it and just maybe tweak things a little bit different. So I wouldn't say there's like a hard and fast no for like a specific activity. It's more like, what's your pelvic floor doing? How is it coping? How are you doing overall? But I will say there are hard and fast things in general. And that's more like our expectations and bounce back culture. And I think both of those two things hinder our recovery because our expectations are kind of the root of all evil in my opinion. Like anytime that we're really upset or, having an issue with something, it often comes back to like, what were we expecting from that? So our expectations can really hinder our recovery and hinder how we're feeling about ourselves in our recovery. And I think a lot of times our expectations are set in a culture that is very bounce back. We're expected to be in our pre-pregnancy jeans by 6 weeks, or, if you look online at, what is it? What is the big, it's not like WebMD, it's the Mayo Clinic, I think. and like what they're telling people is that by like 6 weeks, you should be back to your pre-baby weight for like the majority of women. And we know that's not true. Like what information is out there is like mind blowing. So just like, expecting us to be back to who we were prior to our baby, back to our work role and having that look exactly the same in the shortest amount of time possible, have us be back to our friends groups. I mean, the messaging that we get about like, you should go out for your girls' nights, like you need to do you need to have like your you time. And I feel like that's all like well and good. And maybe sometimes doing some of those things can be really great for our mental health. But also like we're neglecting the fact that we are designed to be very attached to our babies within that infancy time period. So it's just kind of conflicting information and conflicting messages. So I try to set expectations early on, like hear what people's goals are. I think, having goals is great and we're going to work on getting to them, but also how do we make you feel good now in the body that you have now, in the capacity that you have now to do or do not do certain things that you might have been doing before. And just really kind of checking in with yourself and like, where is this goal coming from? Where is this desire coming from? Is it something that you really want, or is it something that you are told that you need to get back to doing? Whether it's for our physical health. I mean, how many times is diet culture like dressed up as like do it for your physical health when that's not always correlated, but we're doing things for your mental health, and it's more than that, and it's a lot simpler than what we make it have to be. Like it comes down to meeting our basic needs, allowing ourselves to heal and process. And that's like not the glamorous fun things that people want to do.
No, it's so true. I feel like if postpartum, we could just turn off all media, and just be in our space, that we would feel so much more comfortable with that. But the messages that we get from everywhere, it just makes it a little bit harder to move into that next phase gracefully, I feel like. So yeah, that's a lot. Okay, before we jump off, I'm just curious if there's anything that you'd want to say to moms that are coming up postpartum, and any like message you'd want them to hear, or like something that you just want to like fill their cup with before we leave.
Yes, it's not as scary as it needs to be. It's going to be challenging, but I don't think challenging has to be bad. And I think I just kind of leave you with that. Like we're going to have challenges, allow those challenges to let you grow and rebuild yourself, your whole self. And there might be times that feel really tough, but you're going to get through it. And if you really allow yourself to plan out your postpartum, to allow for healing, allow for you to reconnect to yourself, to find out like what actually you value, you can tune out the noise better and you'll be happier for it.
This message has been coming at everybody I feel like recently that I've had on the podcast. This has been a very similar, this like feeling in this message. And I'm so glad that this is the new message that we are talking about.
It's time. It's so time.
It's so time. So thank you for sharing that. Thank you for being here. Where can people find you? I know you've got to I got to run here in a second, but where can people find and connect with you?
Yeah, so I'm on Instagram at Arielle Martone. You can find me there if you want to share any of your takeaways, any questions. Shoot me a DM or tag me in something, and I will be happy to respond and hear what your takeaways are from this. And then you can find more about my postpartum plan and pelvic floor physical therapy at my website, which is findyourwaymama.com /about-us is like the main page to go. But if you go to findyourwaymama.com, you'll get there.
Awesome. And we'll make sure to include all that in the show notes for everybody as well. So again, thank you for your time.